Sherman. Good afternoon. My goal today in sharing my story as an LVAD patient, and as someone who is also a doctor, is to shine a light on those attributes that define us as good doctors and good nurses. I also want to spotlight why becoming better listeners will lead to better communication between patients and doctors, and may also help to attain better outcomes for patients like me who have experienced heart failure. My road to becoming an LVAD patient at North Shore began back in 1998 when a lower backache just wouldn't go away, despite trying every possible remedy. I finally went to a doctor who I had expected would refer me to an orthopedist, but instead had the maturity and intuition to see beyond my misleading symptom. He took my blood pressure and a chest x-ray, which revealed an enlarged heart. He then urged me to see a cardiologist that same afternoon, where a stenotic congenital bicuspid aortic valve was revealed. And at 42 years old, I required my first aortic valve replacement surgery. About 9 years later, the failing valve reared its head again. This time the symptoms were respiratory, difficulty breathing, difficulty lying down to sleep. I had waited much too long. My new surgeon, Dr. Colvin, told me, the problem with being stoic, with not complaining, you see, is that it makes it difficult for those who would like to help you to do so. The next thing that happened that had really stuck with me, though, is that Dr. Colvin looked at me and he said to me, "I'm not going to let you die." He didn't seem at all concerned that he was making a promise that perhaps he could not keep. You see, Dr. Colvin was on his mission, one which went well beyond the fear of repercussions had he not carried out this promise. His assertion also let me know that he was not judging me for the way that I had managed my illness. In January of 2019, just over 1 year ago, after a 21-year journey with heart disease, and now as a heart failure patient, I was discontent at 4 different hospitals, always searching for doctors who were not standing in judgment about the choices that I made when it came to managing my illness. But my congestive heart failure had reached dire proportions. I was deathly ill. But I had a separate problem that had great bearing on the course of my treatment. You see, I needed to sell my dental practice. I knew my window for that possibility was closing fast. But for the sake of my family, and my patients, and myself, I was going to sell that practice or die trying. That stoicism was rearing its head again, and I struggled with this inner battle between doing everything I could to provide for my family on the one hand, and doing the things that would need to save my life on the other. And then fate landed me here at North Shore University Hospital. My cell phone research led me to this place, just 6 minutes from my home. I read about a Dr. Lima and a Dr. Stevens who appeared happy and friendly in the photos. And when I met them, and they learned of my predicament, they set out a plan where I would wear a fanny pack on my belt with an IV attached that would provide me the medication, the inotrope, called milrinone, for the 2 months that I needed to sell my practice. And then they would start looking for a heart for me. And that's precisely what happened. It seemed like a miracle. It was the answer that I had been searching for. I'll never forget the way they figured out a way to manage my illness and at the same time honor my humanity by listening to me and respecting me for my right to make a rational decision. And that was the beginning of the dream I'm living today. Don't get me wrong, it hasn't been all that easy and I've been through some stuff. But my surgeon and my doctors have given me more than a puncher's chance at a new heart. We had 2 close calls that just didn't work out so far. But like Dr. Colvin 10 years ago, my surgeon and my other doctors here were determined not to let me die. And they told me so by their actions, and in doing so, have gained my complete trust. And then there were the nurses. Do you know what nurses do here? Well, I didn't. I quickly came to realize that my nurses, Caitlin, Craig, and Paulie, and Judith, were these strangers who suddenly became my champions, who, while I lied on my back attached to an ECMO, unable to move, stood behind me and protected me, and were, as Nurse Sana Goldberg suggests in her TED Talk, the most important connection between me and the entire healthcare system. I think nurses are extraordinary. Have you ever heard a nurse calmly explain everything that happened during his 12-hour shift to the next shift nurse? Have you ever seen a nurse sit silently by your bedside during your darkest hour, telling you with her eyes, nothing bad is going to happen to you on my watch? I have never been in a hospital where through extraordinary communication, the quest of placing the patient's needs ahead of everything else was so apparent. After a difficult LVAD surgery, I struggled in my initial days of recovery. In my new room and step down, I was depressed with this new machine and these batteries hanging from my body. I was miserable to my wife, and I was rude to the nurses. And when my physical therapist, Seymour, and my nurses came to take me for a walk, I barely made the 8 steps before I asked to be wheeled back to my bed. And then about the third post-op day, with the curtain drawn, they did just about the worst thing they could have done for me. They gave me a roommate. It didn't take me long to learn that my new roommate's name was Jose, because Jose never stopped talking. His wife would come and he would talk to his wife, and then his daughter would come and then they'd talk, and then his son would come and they kept talking, and I just needed a little rest. I just wanted a little bit of rest. And then at night, his buddies from work would come, and they'd all be laughing. They're all laughing and talking. And I learned that Jose was supposed to go for a triple bypass surgery. I mean, what's funny about that, right? Well, this went on for close to 2 days, and by the second day, I had it. And about a little before midnight, the second night, I thought of a plan. I thought, because my walker was about 8 feet from my bed, that if I rolled out of the bed the way Seymour had taught me to do, for when I ever got home, if I did get home, that I could reach the walker and walk outside to a chair that I remember being outside one of the patient rooms. And I could get to that chair and wait about an hour, and then walk slowly back with the walker, and maybe Jose would be asleep, and I could get my 5 hours of sleep. I just wanted 5 hours of sleep. So, a little after midnight, Jose was on his phone in the bathroom, I think, and I rolled out of the bed, and I grabbed my walker, and I started to walk towards the hallway, and when I looked to the left, near Jose's bed, I saw there was a stack of Bibles, and about 12 statues, religious artifacts. I found that curious, but I kept walking out the room, and I saw my chair. I was happy. I saw the chair, and I walked towards the chair. And when I got to the chair, I kept walking. I walked all the way around that oval hallway. When I got about 2/3 the way around, I took the walker and I put it out like this with my right hand. I was walking on my own 2 feet. I hadn't been able to take 7 steps before this. I came all the way around to the hallway until I came back to the room, and sure enough, Jose was asleep. Well, I got my 5 hours of sleep, but I couldn't wait to wake up the next morning to walk again. This time I was going to walk the other way, because there was a big window between our unit and DSU, and I knew the sun was out. So I walked towards that window. The nurses were looking, they couldn't believe I was walking. I couldn't walk 7 steps before this. I got to that window, and I put my face up to that icy pane. I let the sun shine through on my face, the sun that I hadn't seen in 6 weeks. And I took a big, deep breath, a breath that I hadn't been able to take in almost 2 years. And then I felt a hand on my shoulder. I turned around. It was Seymour, my physical therapist. He was smiling with that toothy grin of his. And he said, "You're not going to rehab, you're going home." Well, I was so happy. When I got back to the room, Jose was there with his wife. They congratulated me on how well I was walking. I was starting to like Jose. After this most amazing breakthrough, I couldn't help but wonder, what is it that allows a person to go from the depths of hopelessness to rise up against all odds, heal themselves, and gain their life back again? I mean, I know you have to tell yourself to get up and walk and all that, but I had to know what were the lessons to be learned about the other factors which also support healing. And so I did what I always do. I went on my iPad and my books, and I looked for articles. And I found 3 things. The first thing was called The Power of Family and Friends. Did you know the research has shown that family presence has been linked to reducing patient anxiety, decreasing the chance of medical error, and providing an added layer of security for the patient in the room. Having family members in the patient room also improves the communication between the caregivers and the patient and the doctor. And then I read about this thing called the power of laughter. The research shows that laughter reduces the level of stress hormones like cortisol and dopamine, and it increases the level of health-enhancing hormones like endorphins. It also increases the effectiveness of T cells, which helps the immune system. And lastly, there's a thing called power of prayer. Duke University's Harold Koenig, MD, uncovered 1,500 reputable studies that show that people who are religious and who pray regularly not only heal faster, but they don't get sick in the first place. And so it dawned on me, the lessons to be learned were right in front of my face the entire time. They were the lessons from Jose. Jose had all the answers. Everything he did was right. On the following afternoon, as I was being discharged, waiting in a wheelchair for transport to take me in my car, I made sure I had to learn how to say, "I wish you health and happiness" in Spanish. Jose and his wife wished me the same in return as I left the hospital. Now, when I got home, I was left with one more question. How do I thank 150 strangers whose clear mission it was to save my life? And it dawned on me that I could try to thank them in the only way that I could. You see, like Jose, I can talk. So, my mission now, in my new career as a professional speaker, is to inform people about the enormity of congestive heart failure, and to share ideas about how we can all be better doctors. First, the feeling that you get it as a heart failure patient at North Shore is that the needs of the patient come first. Second, this hospital is clearly organized to foster teamwork and collaboration rather than hierarchy. If you want to see the model for North Shore heart failure, the model they seem to emulate, look no further than a documentary that's on Netflix. It's a Ken Burns documentary called The Mayo Clinic. The Mayo Clinic was founded in the late 1800s by two brothers, Doctors Charles and Will Mayo, along with a group of Franciscan nuns. They created a model of collaboration, inspired to help victims of a tornado in a small town of Rochester, Minnesota. Teams of specialists provided patient-centered care, even back then. There's a story from the clinic's early days reflecting their focus on teamwork over position. Dr. Will Mayo, once asked by a patient who was looking for the person in charge, "Are you the head doctor here?" To which Dr. Mayo replied, "No, my brother's the head doctor, I'm the belly doctor." Every problem that I present with, from a floater in my eye to the redness on my leg, which is I am happy to dismiss, is taken much more seriously by everyone here, from Dr. Lima, to Kathy, my nurse practitioner, to Larry, the custodian on 2 Cohen, who also cares deeply about me, and everyone else in between. I'm treated like family by everyone here, and it's indescribable. People sometimes ask me, how can you be so happy when you've been through so much? The answer is easy. I get to dream up my own life. So I try to make a difference and spread a little positivity. As an ambassador for Abbott, and now for the American Heart Association, I go up on the floor in CTU and CCU, and I encourage patients who, like I was, are concerned and confused and frightened about LVAD surgery and heart transplant surgery. When I receive a phone call from a patient who I visited, who can't wait to tell me how well they're coming along in their recovery, I'm absolutely delighted. In concluding, I'm reminded of a quote by author Rob Siltanen. The people crazy enough to think they can change the world are the ones who do. I want to say to our visiting doctors and nurses today, while you would do well to follow the path that the doctors and nurses at Northwell Heart Failure have forged for you, as both a doctor and a patient, I would urge you to forge your own path. Come up with new ideas on how to make your hospital and the world a better place. Remember, the effect you have on others is the most valuable currency you have. Provide real value with extraordinary treatment. Make your mission about treating every patient as a valued individual and honor their humanity. Commit to your team with communication, respect, and collaboration. Be the leader you know you can be. If you do that, I guarantee you'll benefit in ways that you cannot imagine. To my doctors, nurses, and caregivers here at North Shore, I thank you for allowing me the opportunity for a second chance at life. And to my new friends here today, I thank you for allowing me to share our LVAD story.